Province-wide, we have seen the rate of transmission come down to a level of 1.02, and we've seen new case numbers largely plateau over the last couple of weeks. But we are continuing to see growth in under-vaccinated rural areas, and of course, the pressure on our hospitals is severe. So we must all continue to do what we can to reduce transmission and, of course, to increase the number of people who have the protection of vaccines. As of this morning, we had 247 COVID patients in intensive care, down from 257 the previous day, and roughly flat with where we were a week ago. With 60 non-COVID ICU patients, we have a total of 307 intensive care patients in our hospitals. With ongoing efforts to expand capacity, we now have 372 available ICU beds, so we're operating at 83% of intensive care capacity. While it's encouraging that we've been able to ensure intensive care for those who need it by opening up more spaces, it has come at a real cost, both in terms of a huge stress on our amazing frontline health professionals, but also due to postponements of surgeries and other medical procedures. So it is important to note that we are not the only province to have gone through such a challenging period during COVID. Our per capita COVID ICU admissions are pretty much exactly where Ontario was during their spring wave and are well below where Manitoba was when they had to transfer ICU patients out of province. And we are below Saskatchewan's current per capita level of COVID intensive care admissions. Now, I don't say any of this to diminish the very severe pressure that our hospitals are facing, but rather to point out that we as Canadians really are all in this together. We've had ongoing collaboration with other provinces on how best to deal with the surges and hospitalizations like this, and Alberta has always been there to support our fellow Canadians when they needed a helping hand. That's why we shipped cargo planes full of personal protective equipment and over 100 ventilators to Ontario, Quebec, and Nova Scotia during the first wave. It's why we accepted overflow ICU patients from Manitoba in the spring and offered the same assistance to Ontario at that time. In fact, we currently have 9 ICU patients from other provinces, including British Columbia, in our intensive care units now. It's also why we will continue to provide key medical support to the residents of the Northwest Territories who are experiencing a fourth wave very similar to our own. Now that Alberta is experiencing the most intense pressure on our health system during COVID, we appreciate reciprocal offers of assistance from other provinces and the federal government. I can announce that we are finalizing arrangements to welcome a team of medical personnel from the Canadian Armed Forces. We understand that they may be able to provide 8 to 10 ICU-trained staff, which would help us to staff up to 2 additional ICU beds. In my conversation with the Prime Minister yesterday, I said that every bit helps, and we truly appreciate the assistance. This team will likely be located at Canadian Forces based Edmonton, supporting Edmonton area hospitals where the need is greatest, in those hospitals in the Edmonton area which have the greatest need. We're also working with the Canadian Red Cross to welcome up to 20 trained staff, some of whom will have general training and some of whom may have ICU experience. These staff will likely be asked to help at the Red Deer Regional Hospital, which is under severe stress given low vaccination rates in rural central Alberta. Finally, we are completing plans with the province of Newfoundland and Labrador to welcome a medical team, which we expect will include about 5 or 6 ICU experienced staff who will likely be deployed to the Northern Lights Regional Health Centre in Fort McMurray. I really want to thank my colleague, Premier Andrew Furey, for reaching out to us earlier in September to offer the same kind of assistance that Newfoundland and Labrador provided to Ontario in the spring. As he joked with me, Fort McMurray is Newfoundland's second largest city. So this is a wonderful gesture from a province whose people have done so much to build Alberta's prosperity. While details are still being finalized, these contributions may help us to staff 4 or 5 additional ICU beds and provide other support. I know that Alberta healthcare workers will be grateful for the helping hand and that all Albertans are thankful for any assistance at this challenging time. In my conversation with the Prime Minister yesterday, I also asked that the federal government provide us with an inventory of the Johnson & Johnson COVID vaccine. We've heard from a growing number of unvaccinated Albertans that they are willing to receive the Johnson & Johnson vaccine rather than the 3 other vaccines currently available here. Obviously, we want to do everything we can to help get these folks the protection that they need. Saskatchewan and British Columbia have joined us in this request, and the Government of Canada has committed to procuring a supply of J&J doses as early as next week. I also urged the federal government to accelerate approval of more self-administered and non-invasive rapid test kits. A growing number of Alberta businesses are introducing mandates for their staff to show proof of vaccination or regular negative test results. This is leading to a supply shortage of rapid test kits, which can be a useful additional tool in limiting the spread of COVID and keeping workplaces safe. Health Canada has been slow to approve rapid test products. In fact, the European Union has approved 133 rapid antigen tests. The United Kingdom has approved 36, but only 12 of these are approved for use in Canada. I raised this issue last week with Canada's premiers at the Council of the Federation, and we have signed a joint letter calling on Ottawa to accelerate approval of rapid test kits so that we can address the growing demand. As mentioned, over the past 2 weeks, I've spoken to the majority of Alberta's largest private sector businesses about the importance of ensuring that their employees are vaccinated to protect their fellow workers, but also to help us reduce the pressure on our hospitals. I want to thank those employers for stepping up to the plate with safe workplace policies. Thanks in part to their efforts, together with Alberta's $100 vaccine incentive and the new restriction exemption program, we have seen a very significant increase in vaccine uptake over the past 3 weeks, going from 78% first dose coverage of eligible people on September the 3rd to nearly 84% by the end of today. That means that over 200,000 more Albertans now have protection due to COVID vaccines over the past 3.5 weeks. That's great news, but we have to keep the momentum going. And that is why the COVID Cabinet Committee today approved a requirement that all 25,000 employees of the Alberta Public Service show proof of vaccination or a negative regular test results. The majority of employees within the broader Alberta public sector, including Alberta Health Services, post-secondary educational institutions, and government agencies, boards, and commissions have already adopted similar policies. Public Service Commissioner Tim Grant will provide more details about this decision in a few minutes, but the message is clear. We value our public servants and the important work that they do. That's why we want to ensure that they are operating in safe workplaces and that we are doing everything we can to protect the millions of Albertans to whom they provide services. That's also why the Ministers of Health and Education will be writing to school boards across Alberta in the days to come to ask that they consider adopting similar policies for their employees, including Alberta teachers. Finally, let me once again thank our world-class frontline healthcare professionals who are working under great stress in hospitals across the province. And to the 16% of Albertans who have not yet received the life-saving protection offered by vaccines, let me say this. Those healthcare workers want to give you the best care possible if and when you need it. Whether it's a car accident, a heart attack, or COVID-19, they're doing everything they can to be there for you. So please, if you're unvaccinated, be there for them, for those healthcare workers, by getting vaccinated as quickly as possible.